Hello everybody, my name is Lorena Duarte. I am a veterinarian from Brazil, a student of the Masters in Veterinary Surveillance, and I am here today for my first presentation of the 640 unit, so let's get started. Historical role of animals in the emergence or maintenance of infectious disease of people, zoonoses. Zoonotic diseases have always been relevant, however now, they are reaching a greater impact on human health because of the success of human disease control through vaccinations and efficient therapies, leaving a space for new emerging disease being zoonoses. Emerging diseases are infectious diseases that newly appear in a population for different reasons, or diseases that have been controlled before but then reappear. In most cases, the pathogens are well established in animals and then become able to infect and cause disease in the human population, hence being mainly zoonoses, in other words, transmitted from animals to humans and from humans to animals. Despite of zoonoses being known for many centuries, just recently they become main emerging diseases, basically because now human diseases are well understood and efficiently controlled, and there were advanced technologies that allow identification of new zoonotic agents. Both facts raise the appearance of new zoonotic diseases. There are some relevant risk factors for emergence of zoonotic infectious disease. We can highlight the development and intensification of industry and agriculture, which places human population in a close contact with animals of production, or even wildlife because of the deforestation. Globalization, trade, and travel because of the exchange of goods, animals, and people. Change in demography and organization of the cities, which intensifies the contact between people from different areas. Increase of the human population number, which creates agglomeration of people, increasing the risk of transmission of infectious disease. Reduction of biodiversity, which reduces competition between pathogenic and non-pathogenic species, and also reduces number of animals who would not be amplifiers of disease. Climate change, which may increase the vector numbers, and the use of therapeutic drugs against pathogens, which can select resistant species and increase pressure for genetic mutation. Here we have the pathogen pyramid, that is a representation of the interactions among pathogen microbes and human in order to establish an epidemic. So the first step is necessary to create a favorable environment to promote contact between susceptible individual and pathogen is indispensable contact, exposure. The second step is the ability to cause infection and disease. The third step is the ability of the pathogen to spread from a human to another directly or indirectly. And the fourth step is the capacity to cause epidemic, which usually happens when the pathogen finds effective ways to be transmitted between humans. Main animal categories responsible for zoonosis dissemination. A research made in 2007 shows that the main animals responsible for shedding of zoonoses between 1980 and 2007 were not closely taxonomically related with humans. They were mainly animals which have had close contact with the human population along the decades, as the chart shows. We can see that the main three groups of animals responsible for shedding of zoonotic pathogens were firstly ungulates, secondly carnivores, and thirdly rodents, followed by other groups of small relevance as bats, primates, birds, and marsupials. Why were those three first groups the most relevant? The main reservoirs of zoonoses are animals which have been in constant and close contact with the human population for several years for different reasons, most related with livelihood or agribusiness in the case of the ungulates, because they are mainly pigs, cows, goats, and sheep, or for leisure, as shown in the case of the carnivores, they are our dogs and cats, or basically because some hosts are synanthropic animals as the rodents, that usually are around our house, eating our scraps. Therefore, the main risk factor for emerging emergence of zoonoses is contact between human and animals. In the past, the main carrier of zoonoses were poultry and livestock, when their disease were poorly understood. However, with the evolution of preventative methods and efficient surveillance programs, these diseases are considerably under control. And nowadays, and for the future, wildlife animals are expected for being main responsible for zoonosis transmission because of the iatrogen activities which place humans each time in a closely contact with wildlife, and also because of the lack of knowledge about most of pathogens of these wildlife animals. Now I will start my examples of zoonoses which have relevant impact around the world. First, I will talk about visceral canine leishmaniasis. That is a zoonotic and very important for public health in some parts of the world. Is caused by morphologically similar protozoans from the genus Leishmania. In Latin America, 90% of the human cases occur in Brazil, and there are severe clinical forms in humans, and the disease can lead to death of approximately 10% of non-treated cases. And all species of Leishmania are transmitted by a female of a Lutzomia spp, which can feed from dogs, foxes, opossums, and humans. So clearly we can see that the main route of transmission of this disease is through vectors. Despite there are other routes of transmission as sharing of infected syringes when using injectable drugs, organs transplant, or receiving of infected blood, the epidemiological relevant way of transmission is through the bite of the Lutzomia, which injects infected saliva while it's feeding. Therefore, we can say Leishmania is a vector-borne disease. Cycle of transmission and parasitic forms. On the top middle of the screen, we can see now a photo of the Lutzomia longipalps, main vector responsible for the disease spread in Brazil, and under its photo we can see the promastigotas, which are parasitic forms found inside the vector. On the top right and left side on the screen, we can see respectively a photo of a child and a dog, both diseased by Leishmania, presenting the clinical signs. And under their photo, we can see a mastigotas, that are the parasitic forms found in the human and animal tissues. The arrows show that the vector can infect animals and humans, and can get infected by animals or humans as well. Symptoms and signs. In humans, we can see anemia, fever, splenomegaly, hepatomegaly, ascites, lymphadenopathy, pale mucus, dry skin and hair. In animals, mainly dogs, we will see onychogryphosis, that is the exaggerated growth of the nails, anemia, fever, splenomegaly, hepatomegaly, ascites, lymphadenopathy, secondary skin infections, ocular lesions, emaciation, and kidney damage. There are dogs who are asymptomatic or oligosymptomatic. The oligosymptomatic are those dogs who presented just some signs of the disease, nothing too specific. Diagnostic. We will have the serological methodologies, that in Brazil will be mainly the dual platform based on immunochromatography plus ELISA. These tests are done in series, and the animals are considered diseased only if they are positive in both tests. This methodology is used by the surveillance program of the disease in the government of Brazil. And we have also the direct tests, that we can do a smear of bone marrow or lesion on skin and staying with the GIF quit and checking the microscope. Then we might be able to see the mastigotes, or we can also do a PCR. Relevance of the dogs. The domestic dog, Canis familiaris, play a central role for the spreading of the disease, being the main host in urban areas. Places with a high prevalence of visceral leishmaniasis in dogs are of considerable risk for emergence of human cases. Therefore, it is essential to identify infected dogs, and their removal is an important action for breaking the transmission chain. Controlling the vector is a very hard challenge at the moment, because it reproduces inorganic material and putrefaction, Having forests or bush areas around makes the vector controlling almost impossible because all the time there will be organic material in putrefaction for the vectorial reproduction. Another relevant example of zoonotic disease is rabies. Rabies was considered before 100% lethal. Now we say there is around 95% only because there are around 7 reports of people who got infected and diseased but survived to the infection. One of these cases was actually in Brazil, was a teenager who was bitten by a monkey. He spent 6 months in the hospital, but eventually he recovered with the treatment. However, he will have certain conditions that he needs to live with for the rest of his life, but at least he's alive. Rabies is caused by a lysovirus which is sensitive to lipid solvents because the envelope of the virus is made of fat. So if you wash with soap, for example, there is a type of lipid solvents, this virus will be killed. Dogs and cats are still being the main responsible for the circulation of the virus in urban areas in Brazil, hence being a source of infection for the humans. Transmission is mainly through saliva during processes of aggression, bites or scratches in the case of dogs and scratches mainly for cats, of a sick animal to a susceptible mammal. The saliva is rich in the virus that when in contact with cells of the nervous system of a mammal, starts its replication, promoting severe signs and death with the progression of the disease. Pets are the main responsible for the transmission to herbivores and rural areas. Scratches are very important in the cat's case because usually cats are grooming themselves, so they licking themselves all the time, so they can actually transmit this virus from their saliva through the nails, and when they scratch a susceptible individual, this individual can get sick because the virus will be present in their nails as well. Animal symptoms. We will have basically 2 groups of signs. The first one, common in the carnivores, is mainly related with aggressiveness. The other one, common in herbivores, is mainly related with flaccid paralysis, starting in the hind limbs or back legs, progressing to other muscles until reach the muscles responsible for breathing, and the animal eventually dies. Diagnostic. In Brazil is made by the reference laboratories of the government, which try to find inclusion cells in the encephalon through histopathology, and also do inoculation in white mice to avoid mistakes. If these mice get disease, that sample is infected by the rabies virus. We can also do PCR, and years ago it used to be clinical when the population find out and report an aggressive dog on the street, for example. Human symptoms will be a mix between the signs presented by animals, so we can see fever, headache, odynophagia, paresis, flaccid paralysis, disorientation, hypersalivation, double vision, diarrhea, amongst others. Prevention and control. There are vaccinations available to humans. However, this vaccination is available only to people who work in risky areas, as vet, butchers, and biologists, for example, or for people who have been assaulted by unknown animals. For dogs and cats, there is an annual vaccination campaign where the government provides vaccination for free for all the canine and feline population of the country. The vaccination for herbivores is not completely sponsored by the government, so the farmers need to buy it, but it's not very expensive because the government, despite of don't sponsor completely, the government helps with the cost. So people, my time is finishing for this video. I will start a new one. Sorry about that. So I will be with you guys shortly.